Sleeve gastrectomy is a weight loss surgical procedure which removes about 80% of a patient's stomach. With the surgery, we are not rerouting the intestines as with the old bypass procedure. So the food continues through the GI tract in a normal route, but we are limiting the amount of food that a person can eat at a given meal. Sleeve gastrectomy differs from other weight loss procedures in that the procedure is limited to a restrictive type of procedure. In that I mean we are reducing the volume capacity of the stomach. As with older procedures, the gastric bypass, for example, in addition to the restrictive portion of the procedure, there was a rerouting of the intestines to bypass the stomach and the small intestine. With the sleeve gastrectomy, none of that rerouting of the intestines is done, so there's much less risk of complications. The other more popular operation in the past has been the lap band procedure. And in that procedure, a simple collar is placed around the upper portion of the stomach, thereby restricting the amount of food that patients can eat. However, both the bypass and the lap band procedure have been characterized as having different complications characteristic of the procedure, which most of those complications aren't present with the sleeve gastrectomy. Patients are candidates for sleeve gastrectomy if they are 75 to 100 pounds overweight, or if they have diabetes, hypertension, sleep apnea, other comorbidities as we call them, from the weight. It's interesting that currently the sleeve gastrectomy is being studied also in non-obese patients who have diabetes type 2. It's been shown that even those patients can benefit from this even if they're not overweight. The risks of sleeve gastrectomy are fewer than the other types of procedures. As with any surgical procedure, bleeding, infection, so on and so forth are common. However, the risks of a sleeve gastrectomy specifically are a leak from the staple line, which usually occurs about 1% of patients and shows up about a week or so after the surgery. It is corrected by a simple drainage procedure, but the attendant risks for bariatric surgery are much less with a sleeve gastrectomy overall than with the other two procedures. Well, a patient can expect obviously weight loss after the surgery, but again, as a physician, we are not as concerned about the cosmetic results of weight loss as we are about the health benefits of weight loss. And as I mentioned before, hypertension, diabetes, sleep apnea, and a whole host of other illnesses which go along with morbid obesity can be cured or greatly reduced following the surgery. West Jefferson Medical Center and our practice, Surgical Clinic Louisiana, were awarded the Center of Excellence designation several years ago. Hospitals and physicians have to qualify for this designation, and there are a great number of requirements that have to be fulfilled and quality issues involved. So we were awarded the Center of Excellence designation in 2008. We're very proud of that, and if patients are seeking a bariatric surgeon, that's one of the very first questions they should ask is the surgeon and is the hospital a center of excellence, to make sure that they are getting quality results and at the least risk. Insurance has covered many of the procedures in the past. However, just because you have health insurance does not mean you have bariatric coverage under your health policy. So the best way to decide whether or not you do have that coverage is to call our office, have our insurance clerk run the numbers, find out whether your policy does cover bariatric surgery or not. Approximately 30 to 40% of our patients do not have bariatric surgery, and they elect to do a self-pay program. Fortunately, West Jefferson in our practice has been able to provide the service for patients who have to pay out of pocket at a much reduced cost to other places in the country. Following the surgery, patients typically see us back in the office 2 weeks following the surgery. During that time, they are progressing in their diet from liquids to full liquids and so on and so forth. And most of the time, by the time patients come back to the office 2 weeks later, they are ready to go back to work. We typically like to make sure that they stay in a controlled environment, so to speak, for a week or two, but most patients are able to get back to full activities after 2 weeks. If you want more information about this surgery and our practice and the hospital, you can call our office and anyone there can set you up to be able to come to a seminar. We offer free seminars every other Thursday night in our office. We go over the procedure. Lots of information is detailed in that talk, and patients can ask questions particularly for their situation at that time.